welcome you out to Fairview Park Hospital, everyone. We're here with Shawn Humphries. And Shawn, you are now a part of the Fairview Park staff here. And tell us about yourself and what your title is here.
Well, I am a contract physical therapist. I specialize in the performance of electrodiagnostic tests. Some people may know those and had them done as EMG, which is a specialized test for nerve health.
Okay. And EMG. So when you go in and you have a look at nerve damage, when does that usually occur in an individual?
Well, it can occur naturally. It is something that we see more frequently as we age, but it can occur from trauma, whether that be trauma from sports in younger people, or whether it be trauma from injury like motor vehicle accidents or falls and trips and things like that. Sometimes can happen in hospitals. I mean, and so we see sometimes where patients' positioning has an effect, especially in the aged population, nursing homes, things like that, where nerves don't like pressure much. And so when patients are immobile, they oftentimes are not moving to where blood flow gets to certain areas, and nerves can be affected by that.
Okay. So different nerve problems, if you have nerve endings that are not sensitive anymore, does it recognize that type of thing as well?
This test is a very sensitive test for nerve types of problems. This test won't tell us about mechanical problems, and so those are things of muscles, tendons, ligaments, joints, discs, all which can be pain generators, but which are not affecting nerve health. And so this test is often done to help to differentiate between those nerve-related disorders and those mechanical musculoskeletal disorders.
Helps you isolate what the actual problem is.
And so that it gives the physicians a direction on how to treat. It gives therapists an opportunity to direct their treatment. It helps the patient to determine is this something that is likely to get better with time, or something that is more of a long-standing problem.
Okay. So, Shawn, let's talk about some of your patients, most common people that come to you, whether it be young or old.
Well, again, the majority of patients we see are older, and I don't mean significantly older, but generally most nerve problems occur because they can be due to repetitive activities, and so we see an awful lot in working populations that are doing heavy material handling or manual handling types of things. Construction workers, vibrating tools have a tendency to have an effect on nerves over time. We see it in pregnant women because pregnancy has an effect on swelling in tissues, and so carpal tunnel is a common problem, is the most common nerve problem, and we see that commonly in younger pregnant women. Certainly sports injuries can, not frequently, but can affect nerve health. And then a lot of times as we age, nerves age too, and that affects the nutrition of nerves over time. There are certain conditions that have an effect on general metabolic health, such as diabetes and thyroid dysfunction, histories of cancer and things like that, all can have an effect on our body's tissue health, and nerves are one of those tissues. So diabetic neuropathy is a common thing that we see, and this will help. And again, another reason that this test can be important is that someone with numbness and tingling in their feet, for example, without this test, often you won't know whether that's a result of a diabetic neuropathy or other type of related diagnosis of neuropathy, versus maybe a pinched nerve of the low back, which can provide the same types of symptoms. So this is a differentiating exam in that regard.
Okay. So what type of a procedure does one go through if we're going to be checked out?
Well, the test, I always tell patients, I try to put it in as simple terms as possible. The test consists of a couple of things. I use small amounts of electric current. I give them little shocks. The body works on electricity. That's the way our brain speaks to our nerves that speak to our muscles and our tissues of our skin. And so we're able to calculate how fast nerves conduct over different segments. And so healthy nerves are faster and have bigger waveforms. And so with the equipment that we see, we are able to determine speed and size of waves. There's a second part of the test that involves very small, almost like acupuncture types of pins. I try not to use the term needle. It seems to make people more comfortable.
Yeah.
So small pins that we insert into different muscles, and a muscle that has a nerve problem is able to, or shows evidence of tissue irritability, and we're able to detect that if it's present, and that tells us about the health of that nerve-muscle interface.
So when we say needles to most people, some do get a little apprehensive about that. Is it
Almost
painful?
everybody is apprehensive when they first come in. Almost nobody is apprehensive when they leave.
Yeah.
I have about 45 minutes to an hour with somebody, and you know, we really get to know each other. I mean, they know a little bit about me. I know a little about them. Most of them are kind of laughing and joking when they're leaving, and almost everybody says, you know, I read about it and I was scared. The internet can be a great thing, but it can scare the bejeebies out of people.
Yeah,
and so it is really not as bad as what you might read on the internet.
Yeah. So let's go through the process. If one would have carpal tunnel, how would you test them?
Well, Ron, I'd have you sit up on the table.
All right.
And generally what I do, because in order to calculate velocity, we have to know something about distance and time. And so I'll just kind of put you in the machine here, and we'll just pull up Ron,
All right.
and then we'll just start an exam.
Okay.
And so let me have your right hand.
All right.
And so again, it's about distance and time. So I'll make some marks on your hand,
All right.
and then and so if I know distance and the machine gives me a time in milliseconds or thousandths of a second,
Yes.
then I can calculate how fast the nerve is conducting it over those segments in meters per second.
How long have you been involved with this procedure?
Well, I was fortunate. I am a physical therapist, and I learned this exam in the Navy. I'm just going to clip this to your shirt.
All right.
We'll set it right there. We use EKG electrodes, so I've been doing this since 1994.
Awesome.
And it is, so the physical therapists who are specially trained to do this test, perform this test, but also neurologists and physiatrists are the physicians that typically do this test. We're going to put this under here.
Gotcha.
And so, again, the test takes generally about 45 minutes to an hour, depending on the things that we're looking at. Carpal tunnels type of problems are generally simple problems to figure out, and so they're generally less if it's a one extremity. If we have something that's more complicated, like a diabetic neuropathy, then that generally takes a little bit longer.
Okay.
All right, so I've got my machine set up, and what you're going to feel, and the way I'll explain it to the patient, you're going to feel a little shock into the wrist. It's going to cause your first 3 fingers to tingle. It'll cause your thumb to twitch just a bit. And so I'll kind of put this here. That's where your carpal tunnel is, just above it. And so we're taking a time calibration across your carpal tunnel. So you're going to feel a little shock. And now.
Okay. All right.
And we'll take that up. And again. And again. Almost done. Here it comes. All right, so there we've got the waveform. And so that's a nice waveform, and we can compare that to another nerve. So this is one way we are able to determine normality, as we compare it to your other side as well as what normal values are.
Okay, so everyone's
so
individual.
The first blip here is the median nerve at the wrist. That's the nerve involved in carpal tunnel if it's present. And then the lower one is the radial nerve, which we're more to the outside of the arm here. And so we're able to compare these two, and both of these are demonstrating normality. They look good and healthy.
Okay, so doctor, going through the test, I check out all right, but many people will have a little issue, and you'll be able to point it out to them. What's the next step for them? What do? They go back to a physician?
Well, the way, and this is important for our communication to the community, is the way that patients, if they're having unexplained nerve-related symptoms like numbness and tingling, perhaps loss of grip strength, maybe burning sensations at night that are keeping them awake, and things like that. Those are all may or may not be related to nerve problems. And so the first thing to do would be to speak to their physician, and if they and their physician agree that an EMG test may help to elucidate or bring out those potential problems, then a referral can be generated here to Fairview Park Hospital, and we're here regularly to be able to perform these tests and take care of those, and we get the report back to the physician. It then becomes the physician and the patient that decide kind of what next.
Yeah. Yeah, so it helps to isolate the issue. Of course, one would go to their primary physician, then be referred to you here at Fairview
Primary
Park.
physician, or even we get specialist referrals from orthopedics, sometimes neurologists, physiatrists, pain management doctors, even chiropractors and physical therapists, all who may have or who can better care for their patient, knowing what may be the primary etiology or the reason behind the problems that they may be having.
So let's talk about the issues with diabetics and how you've helped people who are diabetics isolate where the problem may be, what the solution may be from there. Because so many people suffer from diabetics in the United
Right.
States. So let's talk about that and how you've helped some people, ways to isolate that or understand it better.
Well, one of the first things is, and recognize I'm not a physician, but it's important to that diabetes, if you've got diabetes, it's really important to keep your diabetes and your blood sugars in control, because diabetes really has a total body effect on our systems of our body. So it affects not just nerves, but the liver, the kidneys, the lungs, eyes. So what we do is we're able to determine the health of the nerves, and that oftentimes is an area of problematic effect of diabetes. And so this then helps the physician determine not just is there a diabetic neuropathy, but also the severity of that neuropathy. Then again, the physician has the tools to address that through medication. If sometimes you can be a diabetic but still have a back problem. And so this helps to determine that is that pain and burning and numbness in my feet and pain going down the back of my leg, is that just the diabetic neuropathy, which may be treated more with medicine and controlling blood sugars and things like that, or is this something that may need a referral to an orthopedic spine physician or a neurosurgeon? Okay, and so that's kind of where we come in, is providing that bit of information. A difference between, a lot of times I'll ask the question, what is the difference between what I do versus an MRI? Well, an MRI is a picture, and it can show, and so the two tests often complement one another. An MRI may show compression in a certain area, or may show a disc bulge or some arthritis that's taking up space, but the nerve may function quite well. So that gives the physician and the patient perhaps a little bit of recognition that this may be able to be treated well with conservative options. If in fact the MRI shows that compression and the nerve is functioning very poorly, then it may move the decision making on, hey, this is something that may need to be done more dynamically or from a surgical standpoint. Again, I'm not a surgeon.
Yeah. So Shawn, what you're saying is it'll help isolate the nerve, and the issue of the nerve throughout the body is something that won't pick up on any other test.
That's correct. Those are pictures, and the two tests complement one another. X-rays, MRIs give us an image. The EMG is an assessment of the function, how the nerve is actually conducting impulses, how the muscle is responding electrophysically to the nerve-muscle connection.
So Shawn, this is just really an advancement, a deeper way to find out from Fairview Park Hospital what the issue is.
Right.
Better way to isolate.
It's another piece. It's another tool in the diagnostic tool belt, and one that we're happy to be able to provide the community here at Fairview Park.
Let's say one would just like to get some more information. And you mentioned, going online. Many times that'll take you way far in the wrong direction. But how would they just get basic information about you and about the EMG?
Well, number one, let me clarify. I think the internet can be a good place, but just recognize that, especially in some of the blogs and things like that, where you're not reading. If you go to WebMD and some of the other more scientifically based websites, you're going to get good information. You'll get good feedback on. You'll get good ideas on what you may expect, and also the things that may be causing your symptoms. But if you're going to some of the more extraneous things where you're getting from Joe Sixpack off the street, you may not get the same information.
Yeah. All right, this is Shawn Humphries, everyone, here at Fairview Park Hospital. Just one more way to better serve our community, to isolate what your health issues may be, and to better serve you. Thanks for joining us today. Shawn, thank you so much for speaking with us.
Thank you very much, Ron.